Hi, I'm Dr. Patty Ann Ford, and I have a terminal degree, a PhD in public health nutrition, specifically in the preventive medicine or preventive care space. And I was trained to look at individual behaviors, but also with the training of understanding there is public health concern and public health policy, and how do you plan health programs for the masses. And one factor that you need to understand is something called the social determinants of health, meaning beyond how people move or what people eat, what is affecting those behaviors or those choices, and that's called the social determinants of health. And that can be education, that can be environment, that can be finances, that can be access to medical care, that can be cultural, that can be poverty, which I've mentioned, some of these things overlap. And so when those things are considered, it's not going to be a program that's going to last very long. It just becomes more of a didactic instruction rather than how can we implement this for best outcomes. A good program for the culture, which it's hard to define a culture for the American public. It's really hard because there's so many different immediate environments. So you want to be able to make changes in a way where it does impact the most people with the least risk. And I hope that's where we can kind of find our way in this system that's really messy right now politically, is how can we impact the majority of people in a positive way towards their health. And I don't know if we're quite there yet, but maybe we're getting there.